once again, good morning everyone. I am Dr. Nica Taloma and this is my lecture on the pathologic complications for pregnancy, specifically for antepartum pregnancy. So our next topic for today is hypertensive disorders of pregnancy. So to give us a quick background on the hypertensive disorders of pregnancy, this complicates 5 to 10% of all pregnancies. So that is the percentage of pregnancies that are affected. And it has a deadly triad, meaning these are 3 symptoms that are considered warning signs for all pregnancies. So first is hypertensive disorder. This causes 16% of maternal mortality. If we take a look at the number, 16% is quite a high number. So pag makita po natin that a pregnant woman is having hypertension, mataas po ang blood pressure niya, this is greater than 140/90. Ang normal blood pressure natin ay 120/80. So here, for this hypertensive disorder, it causes 16% of mortality. So very high po ito. Now, another thing that we should look at is hemorrhage, yung bleeding. Ibig sabihin po nito, excessive bleeding. So, if there is excessive bleeding due to the hypertensive disorder, that is 13%. And if this is accompanied by infection, for example, in abortion, it causes 8%, infection or sepsis, 2%. So, this may lead to deadly triad. So, mortality. Pwedeng mamatay po ang mother natin. So, these are the things that we should watch out for. So, there are 4 types of hypertensive disease. So, take note class, iba-iba ang tawag natin dyan. When you will become nurses, midwives, or doctors, you will be able to appreciate na iba't iba yung type ng hypertensive disorder natin. We just can't say na preeclampsia or eclampsia lang because we have different types of hypertensive disease. So the first one is called gestational hypertension. Once again, if you see the word gestational, it means during pregnancy. So while pregnant, nagkaka-hypertension ang mother. This is defined by having a blood pressure that is greater than or equal to 140/90 millimeter mercury that occurs after 20 weeks age of gestation. So you have to take note of the time kung kailan siya nag-occur. Nung nag-20 weeks na or above, saka lang nagkaroon ng symptom na mataas ang BP, previously naman normal. First trimester and early portion of the second trimester, normal ang BP ng nanay natin. Pero after 20 weeks, nagkaroon siya ng BP greater than or equal to 140/90. We call that gestational hypertension. Another thing na tinitingnan natin is proteinuria. Class, if you see the suffix urea, ang root word natin dyan is, it means urine. Protein in the urine. So kung gestational hypertension, pag pina-urinalysis mo ang mother, dapat wala kang makitang protein sa ihi niya. Or meaning, there are no signs of preeclampsia. Take note class, for gestational hypertension, nagre-resolve din ang mataas na blood pressure niya after 12 weeks postpartum. Postpartum pos means after, yan partum means birth, after niya manganak. 12 weeks after niyang manganak, magno-normalize ang BP niya. So we call this, first one, gestational hypertension. Next, kailan natin sasabihin na may preeclampsia and eclampsia syndrome ang nanay? So this is the second type of hypertensive disorder. So of course, first class, titingnan natin ang BP, the blood pressure is greater than or equal to 140/90, and this occurs after 20 weeks age of gestation. Ibig sabihin, before 20 weeks, normotensive ang mother. So, normal ang BP niya. Next, nung pina-check mo ang urinalysis, pina-UA natin ang nanay. Pag nakita nyo ang UA na acronym, it means urinalysis. Ibig sabihin, analyze natin yung ihi ni mother. So, upon conducting urinalysis, nakita natin na merong protein sa urine. Diba? Urea, it means urine, protein in the urine. And it may be greater than or equal to 300 mg per 24 hours, or the protein creatinine ratio is greater than or equal to 0.3. And sa dipstick, ito ay test din po na ginagawa natin. positive 1 persistent for proteinuria. So in short, class, basta may makita tayong protein in the urine with this criteria, then we consider that proteinuria. Halimbawa, mataas ang BP ng nanay pero wala siyang proteinuria. Sabi niya dito, class OR. Wala nga siyang proteinuria pero nung tinignan mo naman yung platelets niya, mababa. Pina-check natin yung CBC, di ba? Sa CBC, makikita natin ang platelets. Look at this word, class. Ang root word natin ay thrombocyte. Thrombocyte means platelet. Pag nakita natin ang suffix na pinya, ibig sabihin decreased. Thrombocytopenia, decrease platelet. Okay, now, ano ba ang normal na platelet count? Ang normal na platelet count, class, is 150,000 to 450,000. Ito, class, less than 100,000. So, ibig sabihin, we have decreased platelet or anong tawag natin doon? Thrombocytopenia. Okay, next. Kung wala naman yan, pwede rin na ang isang symptom natin ay renal insufficiency, yung ating kidneys. Now, how do we test the functionality of our kidneys? We use creatinine. Itong crea is short for creatinine. So, we look at the creatinine, class. Creatinine that is greater than 1.1 deciliter or 2 times the baseline means that our kidneys are not functioning well. Next, liver involvement. Titingnan din natin, meron na rin ba tayong problem sa liver? So what are we going to look at? We look at the liver enzymes. So we have liver enzymes, AST, aminotransferase, and AST and ALT, class. So they will be twice elevated. Okay? So yan yung mga tinatawag nating liver enzyme. So, these liver enzymes, kapag tumaas sila, ibig sabihin that the liver is no longer functioning well. So, pag sinabi nating AST, that would stand for aspartate aminotransferase. Okay? AST. ALT, alanine aminotransferase. Okay, papalitan mo lang yung aspartate, palitan mo siya ng alanine aminotransferase. Okay? So, ito, class, ay liver enzymes. So, next, we have cerebral symptoms. What if mataas yung BP ng nanay tapos bigla siyang nagkaroon ng severe headache? O kaya sabi niya, meron siyang visual disturbances. Nurse or midwife, sabi niya, parang nanlalabo yung paningin ko, dati hindi naman ganito. So, wag ninyong ipasawalang bahala kapag sinabi yan ng nanay. Kasi, class, baka sasabihin nyo, ay, mother, baka kailangan mo ng salamin. So, dapat i-check nyo. Sabi niya, nanlalabo ang paningin ko. Ano i-check mo? Check mo yung BP niya, di ba? Kasi baka hindi naman eye problem ito, kundi mataas nga ang BP niya. O kaya biglang nag-convulsion si mother. Ito, makikita natin usually common na symptom ito. Kaya dinadala sa hospital, nag-convulsion yung buntis. Hindi pala nila na-check, mataas pala ang blood pressure niya. Okay, and next is pulmonary edema. When we say pulmonary edema, pulmonary, it pertains to the respiratory system, di ba? Pulmonary yung lungs. Edema, ibig sabihin nagkaroon ng accumulation ng fluid sa lungs. So, paano natin ma-assess yan? Pag gumamit ka ng stethoscope, papakinggan mo yung baga ni mother, instead na clear breath sound, ang maririnig mo, maingay, o kaya may mga crackles, okay, mga rales, mga gano'n ang maririnig mo. So, class, ito yung summary ng ating preeclampsia and eclampsia syndrome. Ganun pala, Doc, pag gestational hypertension lang, wala siyang proteinuria. Pero pag preeclampsia or eclampsia syndrome, meron siyang proteinuria and other symptoms na i-check po namin. The third type of hypertensive disorder, we call that chronic hypertension of any etiology. Chronic. Class, when you see the word chronic, it means it already is occurring for a very long time. Matagal na. Matagal nang mataas ang BP ni mother. Ibig sabihin, ang BP niya greater than or equal to 140/90 before 20 weeks of age of gestation. First trimester pa lang o kaya hindi pa nga siya buntis eh. Mataas na yung BP niya. Tapos, the BP may also remain greater than or equal to 140/90, kahit na 12 weeks postpartum na, nanganak na siya. 12 weeks after manganak, mataas pa rin ang BP ni mother. So after 3 months, mataas pa din. We call that chronic hypertension of any etiology. Next, number 4, we call that preeclampsia superimposed on chronic hypertension. When we see the word superimposed, ibig sabihin na idagdag. Ibig sabihin nun, class, meron na po dati si mother, may chronic hypertension na siya, mataas na BP niya even before that. Pero biglang nadagdagan pa ng preeclampsia. So, paano natin malalaman yan? Ibig sabihin, before 20 weeks age of gestation, mataas na ang BP ni mother. Pero biglang nagkaroon siya ngayon ng proteinuria. Nung pinacheck mo yung urine niyan, UA, mataas ang protein sa ihi ni mother. So, sudden increase in proteinuria and blood pressure if without proteinuria less than 20 weeks age of gestation, or thrombocytopenia. No? Ang ibig sabihin nito, pinya means decrease, thrombocyte means platelet. Biglang bumaba ang platelet niya. Wala nga siyang proteinuria, pero biglang bumaba ang platelet niya. Anong tawag natin dyan? Preeclampsia superimposed on chronic hypertension. So take note, class, there are 4 types of hypertensive disease. So next, what are the risk factors? So define na natin kanina what is preeclampsia. So pregnancy greater than 20 weeks, and there is hypertension of greater than 140/90 mm mercury, and meron siyang proteinuria greater than 300 mg per 24 hours. So ito yung tanda na i-check natin. Number 1, greater than 20 weeks pregnancy, mataas ang BP, and number 3, may proteinuria. Now, what are the risk factors? Take note, class, nangyayari ito sa mga bata na nabubuntis, yung mga 17 years old. Okay, mga bata, young, and nulliparous women. When we say nulliparous, null means 0, never pang nagkaroon ng, pag sinabi kasi nating pregnancy, parous, this is pregnancy that already reached the age of viability. So, viable pregnancy na siya. Ibig sabihin, greater than 20 weeks age of gestation. Okay, viable na ang pregnancy. So, ito, mga mother na bata, tapos nagkaka-abortion siguro, okay, kaya hindi nila nare-reach ang age of viability. Next, genetic predisposition. So, take note, class, kahit pala genes, kung ang mother mo nagkaroon ng preeclampsia before, may possibility din because of genetic predisposition na pati ikaw. Next, we also consider maternal weight. Ibig sabihin, class, the greater the weight, kung overweight or obese, or meron tayong tinatawag na metabolic syndrome, which is isa sa mga manifestations nito ay obesity, then it is also a risk factor. Ano pa? Pwede ka rin magka-preeclampsia if there is multi-fetal gestation. Multi means madami, greater than 1, fetus, greater than isa yung fetus. So, pwedeng twins, triplets, quadruplets, or so on. So, habang nagbuntis yung mother, twins ang anak niya, at risk din siya of having preeclampsia. Next, what if in the previous pregnancy nagkaroon ka ng preeclampsia? Does it mean na may chance din na meron ka ding preeclampsia in the next pregnancies? Yes. And then, meron siyang condition called hyperchromocysteinemia sa dugo. These are the risk factors for preeclampsia. So here we have, class, the different classification of preeclampsia. Meron tayong tinatawag na non-severe tsaka severe. So, di ba pag severe, mas grabe. O pag non-severe, mild ito to moderate. So, ang systolic BP is less than 160 mm mercury for non-severe. Pero pag tumaas na yan, greater than or equal to 160 mm mercury, that is already severe. Also, greater than or equal to 110 mm mercury for severe. Thrombocytopenia, sabi natin pinya means decrease, thrombocyte means platelet, decrease platelet. Nakikita natin ito sa severe pero wala sa non-severe. Proteinuria, merong protein sa ihi, none to positive for both severe and non-severe. Oliguria or pulmonary edema, pag sinabi natin oliguria, again, urea means urine, oligo means decrease. So urine output is decreased o kaya may pulmonary edema. We see this in severe cases but not in non-severe cases. Serum creatinine. Sabi natin kanina, creatinine gives us the kidney parameters, diba? Malalaman natin if the kidney is still normal. So for serum creatinine, it is elevated for severe cases. Next, upper abdominal pain. We only see this for severe cases. So this means that there is already hepatocellular edema. Nagkakaroon na ng fluid accumulation sa liver natin. Hepato means liver. Cells of the liver, hepatocellular edema. Next, we also have aspartate or alanine aminotransferase elevation. Ito, pwede siyang tumaas minimally in non-severe cases pero marked ang increase niya pag severe. Ibig sabihin masyadong mataas ang elevation. CNS symptoms, ano yung mga central nervous system symptoms na binanggit natin? Headache, convulsions, blurring of vision. This can be seen in severe cases. And lastly, fetal growth restriction. Yung paglaki ng fetus is affected. This occurs for our severe cases. So that's the difference between a preeclampsia case na severe and non-severe. Take note class, yung mga non-severe cases natin, they may transition to become severe cases. Kaya dapat babantayan natin regularly. Ang monitoring gagawin natin regular. Dapat hindi natin ma-miss ang mga symptoms na kailangan natin i-check. So yan, tinanggal ko for us to review kung ano ba yung mga symptoms. So ang point ko dito class, on your end, you have to check on the non-severe and severe symptoms. So for the preeclampsia, we have laboratory examinations. Ano ba yung mga ino-order natin? Okay? So we have CBC with platelet count. Dito natin makikita if nagkakaroon ng thrombocytopenia ang patient. Pangalawa, we have urinalysis with stat albumin. Ano ba ang albumin? Pag sinabing stat class, ibig sabihin, gusto ng doktor na agad-agad may resulta. Ang albumin is a type of protein. Okay, di ba nga sabi natin, tinitignan natin kung may protein sa ihi. So albumin is a type of protein. BUN stands for blood, urea, nitrogen. So ito, tinitignan din natin to class. Aside from creatinine, we check on this to assess for the kidney function. Okay, next is LDH, lactate dehydrogenase naman. So ito namang ating LDH class, this is being assessed for HELLP syndrome. Kasi if there is increased lactate dehydrogenase, it means hemolysis is occurring. Lysis means breakdown. Ano ang nabe-breakdown? Yung red blood cells natin. Kaya hemolysis. The red blood cells are breaking down. So, part kasi ito ng HELLP syndrome na tinatawag. And of course, also we check the electrolytes. So, Doc, ano nga ba yung HELLP syndrome? So, we have here anemonic. Letter H stands for hemolysis. Yung sabi natin kanina, lysis stands for breaking down or death of the red blood cells. So, this is manifested by an elevated lactate dehydrogenase. EL stands for elevated liver enzymes. Ano ulit yung liver enzymes natin? AST and ALT. Aspartate aminotransferase and alanine aminotransferase. And LP stands for low platelets. So, low platelet thrombocytopenia. So, class, pag nakita natin ang HELLP syndrome, tapos buntis siya at may hypertension, we call this HELLP syndrome. Nakakatakot ba ito? Yes. Pwede bang mamatay ang mother dahil sa HELLP syndrome? Yes. So, it is our responsibility, class, to check on the symptoms. Okay, what is our nursing management? Ano ba ang treatment na ginagamit natin for preeclampsia? We call that magnesium sulfate. So, ito yon. Ito yung gamot na yon. Naka-vial siya, class. So, magnesium sulfate. Now, we have what we call magnesium sulfate toxicity. Ibig sabihin, sobra-sobra na pala yung naibibigay natin sa mother na nagiging toxic na ito sa katawan niya. So, ano yung mga symptoms na kailangan natin bantayan? Ito yung mnemonic natin, burp. Parang imagine niyo si mother nagbo-burp. Pero hindi yung literal na burp. So, it's a mnemonic. Letter B, biglang yung si mother, bumababa yung blood pressure niya, decreased. Halimbawa, sabihin natin 70/50. Naku, bigla namang bumaba. Tapos, alam mo na nagbibigay ka ng magnesium sulfate as a nurse, as a midwife, or as a doctor. Pag nakita mo to, kailangan mong mag-isip na kung mukhang toxic na ang pasyente, nagkakaroon na siya ng magnesium sulfate toxicity. Ibibigay ko pa ba yung next dose ng magnesium sulfate? Hindi na. You hold it. Hold the administration. Ibig sabihin, kahit hindi sabihin ng doktor, huwag mo muna ibigay. Kasi pag nalaman ng doktor na binipi mo na siya at 70/50 ang BP mo at binigay mo pa rin at namatay ang pasyente, pwede natin sabihin na ito ang rason ng pagkamatay niya. Ano pa? U stands for urine output. Tignan mo yung ihi niya. Baka wala na pala siyang ihi na lumalabas or decrease na ang urine output niya. Nagkakaroon siya ng oliguria. Diba? Naalala niyo yun, class? Oliguria. Then, you also have to hold the medication. R, respiration, less than 12 breaths per minute. And letter P, patellar reflex absent. Ibig sabihin, pag i-elicit natin yung patellar reflex, negative na. Nagkakaroon siya ng areflexia. Means absence of reflex. A stands for absence. So these are the symptoms, class, that you have to take note for magnesium sulfate toxicity. Okay, now as a nurse, as a midwife, or as a doctor, you have to regularly monitor the vital signs and fetal heart rate. Ang ginagawa pa natin pag talagang mataas ang BP ng mother, every hour, bini-BP natin to Q1 hour. Okay? Or more frequently. Depende sa sasabihin ng ating doktor or initiative mo din yan as a nurse or midwife. Kung alam mo na hindi maganda ang kalagayan ng pasyente mo, kahit ang order ng doktor ay every 4 hours, gawin mo siyang every 1 hour to make sure na okay ang pasyente natin. Promote rest, minimize external stimuli. Dapat ilimit natin ang bisita, ang maingay na environment. Check din natin ang urine output kasi di ba remember, urine output na decrease means toxicity. And then protein and specific gravity. Assess for edema. And weigh the patient daily. Baka naman, sobra na pala ang manas ng pasyente natin. So, pag i-weigh natin siya daily, it should be at the same time of the day. Kung morning mo siya gagawin. And then, same amount of clothing. Huwag yung masyadong makapal na amount ng clothing. Okay? And then, we have to assess for magnesium sulfate toxicity. Diniscuss na natin yan. Burp. And then, assess for aura. Anong ibig sabihin ng aura? These aura are signs that there is an impending convulsion or seizure. So, pag nakitaan mo, headache, visual disturbance, nanlalabo ang paningin, sumakit ang epigastric area, and loss of consciousness. These are all considered aura for seizure. So, we call this class Preeclampsia. For the medical management class, for Preeclampsia, ang first line na gamot na ginagawa natin dito is methyl dopa. So, methyl dopa, 500 mg every 6 to 8 hours with maximum 3 grams per day. So, ang methyl dopa, pampababa ito ng blood pressure class. Second line, kapag hindi gumagana ang methyl dopa natin, tablet ito. So, pag hindi siya gumagana, magbibigay na tayo ng hydralazine. So, this is also a tablet, 25 mg per orem or orally taken every 6 to 12 hours. Pag hindi pa rin bumababa ang BP ng mother despite giving methyl dopa and hydralazine, we give them a rescue dose of hydralazine intravenous sa suero na natin ibibigay. 5 mg PRN or as needed every 20 minutes for a blood pressure greater than 160/100 with maximum dose of 30 mg. So, 5 muna, no? 5 mg muna. After 20 minutes, bigyan mo ulit ng another 5 mg kung mataas pa rin ang BP. After 20 minutes, 160/100 pa din, 5 mg. After 20 minutes, 10 mg and then 10 mg. A total of 30 mg. Now, class, having discussed about preeclampsia, we now move on to the topic of eclampsia. So these are generalized seizures. Makikita natin there are already generalized seizures that are not attributable to any other cause in a woman with preeclampsia. bigla na siyang nagkaroon ng seizure. Diba, preeclampsia siya, tapos biglang nagkaroon ng seizure. Pag meron na siyang seizure na manifestation class, ang tawag na natin doon ay eclampsia. Ganun pala yun, Doc. Pag nag-seizure ng mother, ang tawag na natin eclampsia, hindi na preeclampsia. Yes, so anong management natin? We give magnesium sulfate. Pangalawa, we control the severe hypertension. Ang goal natin for the BP is 140/90 at least or 150/105. So, pabababain natin siya less than 160/90. But class, what is the absolute treatment? Nakalagay dito, absolute treatment is cesarean delivery. Kasi nga, di ba, pregnancy-induced hypertension. Ibig sabihin yung pagbubuntis niya ang nag-cause ng hypertension. So, for treatment, we deliver them via CS. Pero class, paano pag premature, di ba? Premature pa ang bata. Pag i-deliver mo na siya via CS, is pwedeng hindi siya mag-survive. Ang gagawin natin, we have to control the BP first. Once na ma-reach ng bata ang 37 weeks age of gestation, kung kaya, then we deliver the baby via CS. So that is for eclampsia. So we'll end the video lecture up to this point. Thank you for listening. During pregnancy, I would like to emphasize that. That's why it's called gestational diabetes, because it was only first